Hello again, I'm Dr. Kimbomsoo. In our last video, I introduced you to Total Talus Replacement, a revolutionary way to treat severe damage to the talus bone. Today, let's talk about what you can expect before and after the procedure, so you feel informed and confident every step of the way. Before surgery, we'll do a detailed evaluation including physical examinations, x-rays, and a CT scan to create a custom 3D implant tailored exactly to your ankle. You might think this is a very invasive surgery, but actually, total talus replacement is quite minimally invasive, especially in primary cases. In patients with primary avascular necrosis, we make a small skin incision, usually about 5 centimeters, and the whole procedure typically takes just 30 to 40 minutes. We carefully remove the damaged talus and pop in a brand new one, custom 3D printed just for you. Then we close the wound. And that's it. Because the procedure is relatively quick and clean, postoperative pain is usually mild and rehabilitation can start right away. In revision cases where prior surgeries or implants are involved, the operation may take longer, up to 2 hours, depending on the complexity. Most patients stay in the hospital for 2 to 5 days, depending on their condition. In a primary total talus replacement case, the recovery is surprisingly fast. Just 2 to 3 days after surgery, once the wound is stable, we start gentle range of motion exercises to keep the joint moving. You will wear a splint or walking boot for about 2 to 6 weeks, depending on your condition. Here's the best part. If things go well, full weight bearing without crutches can be allowed as early as 1 week after surgery, as long as it's comfortable for you. By 6 weeks, most patients are walking in normal shoes. And after 3 months, many return to regular activities, including hiking and even light jogging. In revision cases, the rehabilitation plan is tailored to each patient depending on the complexity of the surgery. But our goal is always the same, to help you move with comfort and confidence again. Patients often ask, will it feel like a normal ankle? The answer is not exactly, but almost like a normal ankle.
수술하고 16일 정도나 됐을 거예요. 바로 걸어 다녔어요.
나가 산에 댕기죠.
아유,
진달래꽃 울어요.
100점이네 100점.
정상적으로 돌아와 버렸어요. 아주 정상적으로 돌아왔죠. 완전히 세상을 다 얻은 것 같죠. 저는 그러고 살고 있어요.
For most patients, the pain is gone and ankle motion is significantly better than before surgery. Depending on your preoperative status and postoperative rehab, you may still notice some stiffness. But walking, standing, and sleeping without pain, that's the real difference.
정상처럼 걷지 못한다고.
수술하고 나서는 다리가 아픈 거는 없으니까 언제 아팠었는지 솔직히 잘 모르겠어요. 아파서 뭘 못해, 아파서 이거는 못해 이런 게 전혀 없으니까 그건 너무 좋은 것 같아요.
Many patients are extremely satisfied. They say this surgery gave them their life back. They can walk without pain, enjoy activities again, and avoid more invasive procedures like joint fusion. As with any surgery, there are risks, including infection, implant loosening, or wear over time. That's why regular follow-up visits and x-rays are important to monitor your progress. But the good news is that the pure titanium implants have shown excellent outcomes so far, with many patients experiencing years of pain-free movement. If you're struggling with ankle pain due to talus damage, total talus replacement may be the solution you've been waiting for. In our next video, we'll share real patient stories and show how this procedure changed their lives. Got questions? Please drop them in the comments. And don't forget to like, subscribe, and share this video with anyone who might need it. See you in the next one. And remember, healing takes time, but hope starts today.